All right, so first I would just some hand hygiene. All right. How you doing today?
Good evening.
All right, I'm doing good. My name is Amanda, and I'm going to be your nurse for today. Can you give me your full name?
Janaea Sumter.
All right, Miss Sumter, do you know what day it is?
Thursday.
All right, can you give me your date of birth?
2/11/98.
All right, can you tell me where you are?
WTC.
All right, and what brought you in today?
Just a normal checkup.
Okay, and are you having any pain on a scale of 0 to 10?
No.
No pain. All right, so what we're going to do today is just a general head to toe assessment. We're going to go ahead and start with your head. All right, so the patient head there's no lesions, there's no infestations. The scalp is clean, and we're going to go ahead on and move to your ears. Okay, tell me if you feel any pain. No pain? Okay, we're going to go ahead and take a look inside. All right, so there's no retinas inside, there's no drainage. All right, we're going to go ahead and check your eyes. Are you ready? All right, just look at me. All right. All right, so the conjunctiva is pink. The sclera is white. The pupils are dilating appropriately and bilateral in both eyes. Now, can I get you to look up? I'm going to look in your nose. Okay, so the nose is moist and pink. All right, I want to get you to follow this. All right. So the eyes were conductive. They were able to follow the light. All right. And can I get you to open your mouth and say ah? All right. So the patient has no lesions in her mouth. Her teeth are all clean and even. And the uvula is symmetrical, directly in the middle, and it moved up and down. All right. So. All right, so now we're going to go ahead and check your neck. At any point, does anything hurt? All right, there's no veins, no jugular veins popping out. The skin on the neck is all intact. So now we're going to get you to lay down. All right, so I'm going to go ahead and check your carotid arteries. All right, so they're beating good. There's no irregularity in the beat. All right, and let's see what else we need to do. All right, so now we're going to go ahead and listen to the lung sounds. All right, I'm going to put this 6 different places. I want you to take a deep breath each time. You ready? Okay. All right, I'm going to do the same in the back. Deep breaths. All right, so you have good lung sounds. There is no wheezing. I hear clear. The lungs are clear. And that's it. All right, so now I'm going to listen to your heart, okay? Just breathe normally. right, everything sounds good. There's no sound of a murmur or anything. The heart sounds good. And it's beating at a regular pace. All right, now I'm gonna go ahead and ask you to lay down, Miss Sumter. All right, so normally, first we're gonna go ahead and I'm gonna listen to her apical pulse, and we're gonna do that for exactly 1 minute. All right, everything sounds good then. Again, very clear beating there. I don't hear anything irregular. So we're going to, at this point, I would normally ask the patient to lift their gown or remove their shirt. We're not going to do that here. I've already looked at the patient's stomach. There is no lesions. There's no scarring. The umbilicus is directly in the center. So there's no mass or anything. So next I'm going to go ahead and listen to make sure that she has normal bowel sounds. Okay, so there are normal bowel sounds in all 4 quadrants. They're very active. All right, so next I'll go ahead and inspect the patient's legs. First I'll palpitate. Make sure there's no swelling, which I don't feel any swelling. I don't feel any lumps or knots anywhere. We're gonna go ahead and inspect it. All right, the skin is clean and clear. There's nothing there. There's no edema of the legs. We're gonna go ahead and check her pedal pulse. See if we can get it through these shoes. All right, so she has a good, strong pedal pulse bilaterally on both of her feet. And we're gonna go ahead and check the tibia. Check the pulse in the tibia. Okay, so that also has a very strong beat. And all right, so I think that we are all done with the bottom part. Can I get you to sit up, please? All right, so here we're going to check the patient's range of motion in her head, arms, and legs. So can I get you to turn from side to side, up and down? All right, so she has perfect range of motion in her neck. All right, so can I get you to raise your hands? I want you to push out. Okay, I want you to push in. All right, push towards me. All right, now push. All right. All right, so she has perfect strength, a 5 in her arms. We're gonna go ahead and check the legs. All right, so I want you to push out. All right, push in. All right, push back. All right, and push towards me. Okay, so she also gets a 5 in the leg area, full strength in both arm, legs, and neck. Skin. I don't know if I did your hands earlier. All right, I'm going to just check the hands, and they are intact. The nails are good, they're clean. There are no clubbing going on there, and patient has really good skin turgor. All right, so I am now done with that head to toe assessment. Is there anything I can get for you? All right, well, if there's nothing I can do, I'm going to go ahead and give you the call light. All right, and the doctor will be in as soon as he can. Okay, call me if you need me. All right. You're welcome.